I'm really pleased that we've restarted outpatient appointments both face-to-face and telephone, and many of you may have received a new appointment letter. We've also restarted planned procedures and operations which were previously on hold whilst we focused on the impact of COVID-19. This is great news, but worryingly we're seeing large numbers of patients not attending their appointments. This is really something that worries me, and some patients could be putting their health at serious risk. Our waiting lists for planned procedures and operations are currently longer than normal because we had to postpone many operations whilst we focused on responding to the pandemic. We are doing all we can to reduce our waiting lists and get patients the treatment they need at the earliest opportunity. One of the ways we are doing this is working with the independent healthcare sector to use the space and capacity available in some of the local private hospitals. These include the BMI Ridgeway just down the road in Rawton and the Devices Treatment Centre in Wiltshire. Having this extra capacity at this time means we can see more patients, work through our waiting list more quickly, and most importantly, ensure patients receive the treatment they need sooner. Currently, about 15% of our patients waiting for planned procedures and operations are being offered treatment at a private hospital. The sorts of treatments being offered include endoscopies, hip or knee replacements, gynecology surgery, and some outpatient appointments, including dermatology. I understand that some patients are reluctant or may feel anxious about having their treatment in an unfamiliar environment, and in some cases it may mean having to travel a little further. I can assure you that all of the private hospitals we work with provide the same high quality treatment that you would expect from an NHS hospital. They also have the same stringent safety and infection prevention control measures in place. Our absolute priority is to give our patients the treatment they need at the earliest opportunity, and at this time this is one of the best ways to do this. As we have throughout the pandemic, we all need to play our part. By not attending an appointment that's been offered to you, you may be putting your health at serious risk. This is why we're asking patients to please take the appointment offered to you, regardless of whether it's at the Great Western Hospital or with one of the independent providers we are working with. If you really can't make your appointment or you no longer need the appointment, it is important that you let us know as soon as possible so that we can give your appointment to another patient and reduce the length of time other patients need to wait. Thank you for your continued support for the NHS.